Time now for this week's Health Matters. PA Lynn Szabo, along with myself, Paul Critz, here, and we're discussing a topic that's been a big part of my life, the seasonal illnesses that are going around. Specifically, a question that came up in a Facebook thread. Was this the one that I was talking about? Hey, is anybody going through this too? That thread, yeah.
Right.
So I was sick longer than I've been in a while, and asked Facebook friends online, hey, have you guys seen this, where it kind of comes and goes and moves around? And there was a comment that came up from a friend of a friend on Facebook. And do you want to address that comment? What was said in that?
Yeah, that was a mom who was passing along some concern that she had, and I think that was supported by a practitioner that she saw, that this year's cold and flu season is more severe, and providers are perplexed by that. And I think it was a little overstated.
Is it true, though?
It is, but in an expected way.
Okay.
We knew that influenza would be a little bit harder to deal with this year because in past years, when we masked up starting in 2020, the amount of circulating illness really decreased. Mm-hmm. So that means our immune systems are not really up to date with the potential for what's out there in general, not
right. just
COVID, but other stuff. But on the other hand, it implied a certain distress that healthcare providers have, like we never saw this coming, and we're like Bambi in the headlights of the Mack truck, and mm-hmm. we don't know what to do about it. So we did see it coming. We talked about it, it seems to me, ad nauseum, but and then we talked about how it could be prevented. And then I think people, especially moms, because moms this time of year get super frazzled about sick kids, and I guess I would extend that to all parents, but it's very, very hard to have a child who's breathing funny, quote, air quotes, and the parental person feels like they need to sit up all night and watch that child breathe. It's mm-hmm. certainly terrifying. Been there, done that. I bet you have. Mm-hmm. And I think it's easy to be alarmist, but I'm here hopefully to calm everybody down about it.
Okay. All right. So, so what sort of misconceptions or hyperbole are feeding into this sense of catastrophe this year?
Right. So the first thing is the expectation of parents with school-age children is that their kids will get sick twice in a school year. Mm-hmm. That's like way off.
Really?
The expectation of healthcare providers is that the average school-age kid, or maybe kid in daycare, so, the 3 to 4 year olds, will get sick once a month.
Oh my gosh.
So that's way different.
That's, yeah.
And I don't know if it's wishful thinking or if it's how you define sick, or I think parents just kind of go with denial sometimes, mm-hmm. Because it's easier. It's hard to have your heart live outside your body. So nationwide, though, as far as immunizations of kids, 88% of kids have gotten flu shots, and 47% have gotten COVID vaccine. And I suspect the numbers here are really a lot lower.
Probably, yeah.
I was like, what? 88%? Yeah. They're almost always declined in the exam room. And there's also almost no time for discussion about when the optimal timing is for it. So sometimes kids get flu shots like in May when they don't really need them.
Right.
So, so I think there's a super disconnect between what parents' hopes are and what the reality is. So.
Mm-hmm. Okay, but there are things this year that are different about past years.
Completely different.
What sorts of things?
And it's super cool in a way. But this is the first year I've ever worked a cold and flu season, and I had full access to genetic testing that was quick, easy to get, easy to run, easy turnaround time, that really augments my understanding of why somebody's sick. Mm-hmm. And so this year we have not only COVID testing, but influenza A and B, RSV, and then, of course, the classic strep. Mm-hmm. Okay. So what's different about this is it was always thought that when people got sick with a viral illness, that they only had that one illness, and there wasn't only one viral illness, and you couldn't really get co-infected with stuff. And that's never been data driven. I don't know why providers have that understanding, because clearly you can have more than one virus. Take people with HIV and co-infected with Hep C. So there's definitely examples of people fighting off more than one disease at a time.
Right.
And so what we're seeing now, so we've got the tools to actually see what somebody has, instead of just saying, oh, it's a viral syndrome. The provider in their mind knows those are all treated the same basically at this point. Conservative, monitor for signs and symptoms of concern, fever control, hydration, blah, blah, blah. And actually, I think patients sometimes interpret that as when we say, oh, you have a virus, then that means we don't know enough about specifically what's wrong with them. Well, now we do. Now we have that opportunity. And we're seeing people that have more than one virus at a time, or more than one disease entity at a time. And the most of what I'm seeing actually is like COVID and strep. We kind of call it strep rona informally. And to the point where the quick strep is positive, but the culture is negative. And I'm wondering if there's something about COVID that's making the test less useful. So, there could be false positives and false negatives in all testing. So, but now we know, and I think we're surprised. So I don't think that providers are, befuddled. I think they're a little bit surprised, and then they're evolving to change their approach and their understanding.
Okay.
And that's not really a bad thing. It happens all the time in medicine.
Yeah, yeah.
But you remember when COVID first started, and a lot of people were sick just before February of 2020, and a lot of people swear they had COVID before COVID was known. Almost none of those people did.
Right.
So, the DNA testing on that and the antibody testing shows that really COVID showed up in February. So, but that's arguable and will probably evolve. But what patients say about that is, I had something and the doctors didn't know what it was.
Must have been.
We totally knew what it was. It was a viral syndrome. But that's like saying apples, and people want to know, do they have a Granny Smith? Do they have a Gala? Do they have, Jonathan, whatever? So providers understood it, and now we have a deeper understanding, and we're still not terrified about it. We're a little frustrated. We're a little bit tired.
But, and that was part of the comment on Facebook, was that a provider had said, now kids this year are just coming back. They're testing for all kinds of things.
Right.
And that was just always the case. Now we have easy access to those tests.
Yeah, now we
to
just
show
have
that.
better names.
Gotcha.
Yeah.
Okay.
And what we're seeing now that we have these cool new tests is that, a kid will just get over influenza, and then like 2 days later will get RSV. And so what it looks parentally like, the kid is still coughing because of the same disease, but actually there's either maybe a little bit of overlap or a total shift in different diseases.
Right. Wow.
So yeah.
And I guess that's a good thing. We have the ability. It's just now we need to sort out this
we
new
have to
information.
be less sensitive to the downside of it, because it's really an upside to have these tools. Super good. So. But the next part of that concern that mom had is that kids and families are sicker than usual. And I think that this goes, that just a couple of things feed into that. One is that we're, for the last 2 years, we're not really used to seeing sick kids, because they were well protected with masking and social distancing and remote learning and stuff like that. And now we're seeing it again, so now we remember it. But the other thing is, about this time of year, and I kind of touched on this previously, parents are tired of having sick kids, and they start to get fearful that their kid, having RSV, influenza, and COVID and strep means that child has an impaired immune system.
Right.
Yeah, and I think that's a legitimate question to bring up with a provider, but the providers are not fearful about that.
Right. Because first, blush, you've got a working immune system.
Yeah, I'm trying to think of the whole time I've been up here, I only remember one kid that actually had acute leukemia. It kind of looked like the worst strep ever. But that's not super common. And, for kids getting sick and then also getting over it because they have amazing immune systems, this is kind of the way it goes.
Right.
For kid life. Remember, there's two parts to the immune system, the innate and the acquired. So everybody's born with innate, okay? We already have all our acquired as adults, so we don't continually get pounded. But this is the journey that their acquired immune system is
Right.
taking.
You've got to go through all of that. Yeah.
But it's hard to talk to a mom who hasn't had any sleep for 3 days and doesn't like that sound that her kid makes when they cough. And this is also kind of a second problem with that is kids under 6 or 7 have no really good options for cough control. This almost always goes to cough at night. So these kids have no good over-the-counter, medication options to control cough.
Really?
It doesn't really work. Side effects are more of a problem. And all everybody wants to do is just sleep, And so things that can be helpful here, and I find this first one ironic, is a humidifier or a vaporizer. So a vaporizer is warm mist and humidifier is cool mist. And if you think about it, we kind of live in a humidifier.
Right, yeah, all the time.
And so you're telling people who might have a mold problem in their back room that they have to humidify their air, and they just look at you.
Yeah.
But the other thing is wood stoves. Wood stoves are becoming more of a recognized kind of indoor pollution problem. And this is the time of year where people who heat their homes like that really have a problem. So I think an air purifier could help too.
Wow, okay.
So just throw those two out there. Don't forget honey. Honey is actually the best cough suppressant for kids over the age of 2. Okay. And I don't mean honey that's in a prepared over-the-counter.
No, but
thing.
straight up raw honey.
Straight out of the honey bear, and usually a teaspoon or two, depending on the size and age of the kid.
Wow, really?
Virtually no side effects, and it doesn't work great, but it works better than what you're buying over the counter. And so just a little reminder: people that are selling cough suppressants for kids in that age group over the counter are not interested in kids not coughing. They are interested in making money. So just because they market it as that doesn't necessarily mean it's true.
Right.
Okay. So
why is that? Why is it so difficult to get medication for younger kids like that? Is it just because of the things that really work, are just like too strong for a kid's system? When you're talking about cough suppressant,
kids just respond different to medications.
Okay.
So, common cough suppressant is dextromethorphan, for example, the DM, and it just doesn't work with kids. Instead of making them sleepy and less coffee, it makes them wired and more coffee.
Wow, no.
So, it becomes like stuff that grandma used before that stuff was available over the counter. And some of that stuff just isn't good. So even if it's, groovy organic, it's still not working well. Okay.
Okay.
So,
wow. Well, thanks for clearing up those questions.
I thought the deeper dive was worth it on that.
And that's really interesting.
I feel for patients or parents with sick kids.
Yeah.
It's really hard. And I'll just remind you, I'm happily busy seeing sick kids on Saturday from 10 to 2 at Open Door. As UHS, Marty Kimball's over there seeing sick kids about the same time. I think it's 9 to 2.
Wow, okay.
Yeah, we saw 20 yesterday.
20, yeah, wow.
It was kind of fun. Yeah. So, and then of course there's the ER, but it would be nice if providers could do more to educate parents on what really signs and symptoms of concern are, because it's really, really easy to panic.
What sorts of things should be concerns then?
Well, retractions, especially in an infant, are a worrisome sign. That's where the flesh on their bodies, on their chest cavity, is like sucking in between their ribs when they breathe. Any kid that's got respirations over 40 is somebody who should go to the hospital. So that's 40 respirations per minute. Okay. So counting respirations, hugely helpful, but almost nobody really knows that. Other things that kids do is kids can take a lot for a long time and then they crash. So a crashing kid is going to have like blue around their lips, and maybe fingertips blue, that's the time to probably call 911, actually. So you can be tolerant with a kid who's got a respiration rate of about 20, because that's kind of where most of them live when they have a fever. But 40 is what gets the provider's attention really quickly.
Okay.
Kids with pneumonia, too, especially babies, they grunt. They make a little if you're seeing that consistently, it's time to go to the ER.
Okay. Wow.
Okay.
Wow. All right. Well, I'm going to be quite honest with you, because the whole comment string on Facebook was because I'd been sick for about 3 weeks, well, about 2 weeks at this time, and it's still kind of hanging on. And I don't feel great this morning, and I'm going to go and lay back down.
That would be a good thing.
Okay, thank you.
So,
And
we have to remember that normal cold virus is about 2 weeks
wow.
of sickness.
Yeah,
it's not like I've been sick for 3 days and this must be bacterial because I'm not over it.
Right.
Right.
So this seems to come and go too. Like you'll have a couple of good days and then something just not happening. Right. And yeah. So, thanks for the foreshortened Health Matters.
Yeah. So, yay.
Yay. So I've got playoff football and a bunch of hydration ahead for me for the rest of the day.
Hey,
so
I'm glad to hear that.
All right. Lynn Szabo, Health Matters. Thank you so very much. And we'll do a full half hour this next week. Thank you again.
Awesome.